So the principal frontline therapies for metastatic RCC fall into which risk groups these patients are in, whether they're favorable, intermediate, or poor risk. And dependent on the category that these patients fall into, then we will select a treatment that we think will be best supported in that group. I said earlier that those with favorable risk ought to probably be considered for a TKI, and the side effect profile of TKIs are very well known. So the toxicity profile of TKIs need to be considered when you're offering those drugs to that subset of patients. High blood pressure, the risk of heart, thrombosis, bleeding, rash, hypothyroidism, fatigue. So all those need to be weighed when you're looking at or seeing a patient with favorable risk disease. For patients who are in the intermediate risk or poor risk categories, for whom you are considering an IO therapy for, such as Nivo/Ipi, certain considerations apply. For example, if they have autoimmune disease that's active, such as rheumatoid arthritis, for which they received or are receiving active interventions, you would probably not offer those patients an IO-based therapy because of the risk of autoimmune disease exacerbation. So for a subset of patients with intermediate and poor risk disease who are probably not the best candidates for IO therapy, you would offer them alternative therapy, and that would probably be a tyrosine kinase inhibitor.